Eric, we're going to have Sunday House Call, but
Yeah.
before we do, we should talk about Joe Paterno, because a lot of people out there are probably wondering, diagnosed with lung cancer, and then he dies.
Yeah, broke his pelvis. This all came on just since October. Doctors, pretty shocking, sudden. We knew he was in the hospital and in ill health. But can lung cancer really take you that quickly?
Eric, the problem with lung cancer is it's about 180,000 cases per year, but there's almost the same number of deaths from it. It's one of the most deadly cancers we have, especially in smokers. 7 to 8 times more lung cancer in smokers. And David and I have talked before about early detection. Even if you diagnose it early, you don't necessarily save the patient, but it's the only hope you have is to get it before it's spread. If it's a small tumor, you have more hope. But again, a smoker, under the amount of stress he's been under, it can grow more rapidly, in my opinion. It's very tragic. By the way, he was a Brown alumni, which I am also, and I wish his family the best.
Yeah, they're a really incredible family who has suffered so much this year, but once the diagnosis is made, Doc, and I'll welcome both you, Dr. Mark Siegel and Dr. David Samadi, but we want to ask you to weigh in because people are probably concerned. Once you get diagnosed, is there any treatment?
There are excellent treatments for this, but it depends on what stage you're being diagnosed. And one of the things we talked about 2 weekends ago was the fact that some of the low-dose CAT scans can diagnose you early on without a major risk. And the key, exactly what you said, is really good screening and finding out that you have these lesions or nodules that are not symptomatic. Obviously, in a case like this, it probably was an advanced disease that was found and it was late. But a lot of surgical treatment, and surgery is the first line of treatment with lung cancer, followed by many chemotherapies. But the sooner you get it, when it's smaller, the result is much more effective and could be curative.
So then what's your advice? What should people do out there who are watching now if you're concerned about the
Stop
potential
smoking.
diagnosis?
You got to
Agreed.
stop smoking.
You knew
That's
that was
rule
coming.
number one.
Stop smoking, number one. And if you are a smoker, check with your physician about whether you should have a CAT scan.
Yeah.
Absolutely.
All right.
Hearts and prayers.
We'll have more
to all.
on Joe Paterno throughout the hour and through the next hour also. Let's now continue with